things like conservation of PPE even before the first cases hit.
Sure.
So that way we knew that we had the equipment that we needed to protect our staff for the long haul. So, usually, a person gets a mask, they throw it away, they'll, throw it away right away. We had people start holding on to them, storing them in paper bags. We've actually gone to reprocessing some masks using UV light and using some other products, just so that we could get a handle on, what we were seeing really across the world with lack of PPE available, in different hospitals. So we wanted to make sure right away that we weren't encountering those issues. Actually, our community members have been fantastic. We've had a lot of, different organizations in the community donate masks, donate face shields, which the face shields were helpful because they allowed us to, put the face shield on and actually add another layer of protection to the masks that staff are wearing.
Is it like full plastic?
Yeah, the plastic shields. Yeah. So we actually did a lot very early on before we even started seeing cases, so that we could kind of be in this for the long haul. We started meeting via telephone conferences with other organizations in the state. So every day at 2 o'clock, there's a state call where all the hospital systems join the call in addition to public health from the state of Delaware and DEMA. And we talk about resources. We talk about, what we need as far as PPE. If one hospital is running short on something and we have a supply, then we do share resources with other hospitals as well. So those things have been going on really since, again, before we even started seeing our first cases. As we started seeing cases and the numbers started increasing and we started burning through some of our PPE quicker, the state has provided us some of the resources from stockpiles that they had. We've actually done collaborative things with Christiana Care to order supplies from vendors that we've not ordered before and vice versa. So, Delaware's unique in that we're small and we have those relationships with our other organizations, so we can do a lot of information sharing.
Sure.
We set up very quickly, just like other organizations did, to actually go out in the community and start testing community members. So we started weeks ago having drive-through testing sites. So there's a team of staff through our call management system where you can call if you're having symptoms. You can talk directly to a healthcare provider, whether it's an advanced practice nurse or a physician. They can screen you via phone and then refer you to the testing site. So they give you an appointment so you can do drive-through testing and not even have to get out of your car. So we've been doing them pretty much every Tuesday and Friday for probably 2 months now. They see on average between 200 and 300 people a day in a 4-hour span through those drive-through testing sites. We've actually engaged with public health to actually go and do testing down at the poultry plants. And so we worked with BB and Christiana and Nanacoke. We all took a different processing plant and worked with the state to go in and start testing the poultry industry. And in a short period of time, they tested over 300 people. They're actually back down in Milford today doing community testing, which is just you just drive up if you feel that you need to be tested. So we've been doing a lot of outreach. The state has been really great about providing us the testing kits to do those drive-through testing. And then our call management team actually takes the information of the person who's getting testing and they actually follow up with them. So they'll call with the results, they'll call with education on how to quarantine. If they are positive, they call more frequently to check on symptoms to make sure they're not having any issues. And if they start having issues, they will refer them to come into the hospital. So there's been a lot of great stuff that's been going on both here at the organization level and then with the collaboration with our other healthcare systems across the state. We're very fortunate.
Speaking of that testing, what is the general direction on the newer antibodies tests that they are just supposedly just starting to offer? What are they recommending if you have had symptoms, or is it meant for anyone just to get tested?
So right now, from what I understand, the criteria is if you've been tested positive and then you go back and you test again and you have a negative result, then they will send you to have the IgG, IgM testing, which is the actual blood test to see if you have the antibodies. If you have developed antibodies, then they will ask if you want to do a plasma donation because they are starting to treat patients with plasma donation to see if it helps to expedite getting better if they're in the hospital with COVID-19. So we've treated a few patients so far with plasma testing, but it's not something that's immediate. It's not that you give it and the next day they're better. It does still take a week or two. So we're in that phase where we're waiting to see how those patients start faring from the plasma testing that's been done.
And when you're doing like experiments like that, in the sense of like reporting, tracking those results or lack of results, and reporting that, how much leeway does like your individual hospital, let alone the state of Delaware, kind of collaboration have that leeway for tracking what works and what doesn't?
So, we work with what the guidelines are through the federal and the state government. There's been a lot more leniency in some of that kind of testing that's being done, meaning not necessarily going through all the FDA approvals, but we do closely monitor and track those patients just to make sure that they're having positive outcomes. And then we do report all of that information back to the state and the federal government. Mm-hmm. So there's forms that we fill out every day that we have to turn into both the state and the federal government and what all the efforts are that we're doing for everything that is related to this pandemic. And so we have to give them everyday numbers on number of patients we have that are positive, patients that are of persons of interest that we're waiting for test results to come back, how many patients are on ventilators, how many deaths we've had related to COVID, how many patients have gotten better. So we have to report out a lot of data to the state and federal government in regards to this pandemic. And so we comply with what they recommend.
Gotcha.
It's a lot of data collection.
Sounds like it.
It's been good though. I mean, we've definitely had our success stories. We have had some, patients come in who are really, really sick that have been with us 30 some days on a ventilator, looking like things weren't going to go well, and then they get better and we've discharged them back home to the community. So wow. We've had a lot more successes than we've had failures, which is what we like to hear. That's what we want to see. But now we play a little song for them. So when they do get discharged, we play the Rocky theme song to celebrate them going home.
That's
so just trying to make things fun.
Have there been any cases where someone has, was positive, was in the hospital, was treated, got better, and then went home and then ended up having to come back at all?
We have seen that one time.
Okay.
But for the most part, they do a really good job with the call management team and screening people and making sure that they're appropriate to come in. And then obviously making sure that if they are getting sick, that they're getting treated right away. So we do follow up even after people are discharged. We do follow up with them at home too to make sure that they're not having any relapses in their care. So, of the several, probably 100 people we've discharged at this time, to only have one really relapse and have to come back in is pretty good.
Sharon, do you think that kind of the telemedicine is the future of healthcare? Like we won't have to come in until we're like really at the point?
It's funny. We actually just had this conversation this morning. Because believe it or not, we've been in the midst of this for a couple of months now. And so we started having those discussions on how do we go back to normal.
Mm-hmm.
So how do we open things up to start doing elective surgeries again? And how do we go back to transitioning from kind of shutting everything down to just people needing to be in the hospital? And so we actually started those discussions about, is telemedicine really the wave of the future? And so the answer is probably yes. It's, as bad as this sounds, hospitals are a business, and reimbursement for telemedicine has been not something that a lot of insurance companies have reimbursed for. But we do think that with all of the changes that have happened with COVID-19, that a lot of insurance companies are going to change their thoughts about telemedicine and virtual reality visits, because they do work. And so, just like we're here on Zoom now, there's physicians that are doing the same thing, seeing patients.
Yeah.
And treating patients by video conference, because it's amazing what technology can do now. And so I do think you're going to see a lot of changes coming when this is all said and done.
Absolutely.
Yeah, it's interesting.
You can reach a lot of people.
It's so interesting because, a lot of times people have recurring things. I am very prone to sinus infections, and I know exactly when I'm getting one and all of that. And, and my doctor knows me well enough to know that too.
Mm-hmm.
And so I could see that in a case like that, rather than clogging up the doctor's offices, it would be simpler to just be, and quicker to just
Absolutely
do it this way.
You get your medicine prescribed and you're good to go.
That's right. Just get your drugs and you're on your way.
And, different states do things differently. So Maryland, they actually partner with some of their larger employers.
Mm-hmm.
And this is how they do their appointments. They actually do them via telemedicine or Skype before they actually go into a doctor's office. So, sometimes the different states drive things differently, with how they want to do things. But I had a friend of mine that wound up having pink eye a week ago, and she lives in Maryland, and she called up, she Skyped just like we're doing now. And, they had her get her eye close to the monitor screen. Yep, you have pink eye. I'm calling in a prescription. So, I mean, I do think this is going to change how medicine is being done in the future.
It's been interesting to watch across the different industries, the creative things that people are doing. And to think about how, some of those new techniques and strategies are things that we're going to take into the future. That's a good part. It's forced us to be more creative than usual.
Absolutely. And we've used things like telemedicine as adjunct therapies, for different things, but not as like primary. So, sometimes it's, at nighttime, if, we need a consult from like a certain type of physician, we do have a computer that's got, a monitor on there and a camera that we can wheel in a patient's room, and they can do a quick consult, within a follow-up visit the next day. So but I do think it's going to change primary care for sure.
Yeah.
Which is needed because there's just not enough primary care physicians out there.
Mm-hmm. Sharon, I want to know who's responsible for those cool windows at the hospital.
Which ones?
Well, all of them. I mean, is that somebody's brainchild? Was it a contest, or did people just start doing it to put the decorations up in the windows?
You know what? People just started doing it. The staff, just to brighten people's day coming in, started putting stuff up. We've had different visitors, believe it or not, have come and chalked things on the sidewalk, little messages of hope on the sidewalk. Actually, the mayor's office, here in Dover, actually came and put signs of hope up across the campus on the yard. So our communities have been really great to us. And
that's awesome.
The fire department and the police departments were out at both the Kent and the Sussex campus. you know, at change of shift one day, you know, with their sirens and clapping and cheering for the staff. So it's been a lot of fun.
That's
You know,
cool.
it's those little messages of hope and, you know, dark days that, you know, I think really, really make the staff feel special.
That was going to be my question, like, you know, from leadership. I mean, obviously you hold a leadership position there. You know, what are some of the things that you're doing with your team to keep, you know, their morale up? Because, I mean, I'm sure they're putting in extra hours and, you know, being afraid to go home to their families to pass on any, you know, contamination or anything like that. Like, what are you guys doing to keep them happy and healthy?
So a lot of it's just talking with them, you know. I know I bought all of my managers little trinkets of hope, you know, little bracelets with, like, you know, inspirational messages,
Nice.
leaving little inspirational messages at time clocks. And when people clock in the morning, they see, you know, something from leadership. My boss and I, we do calls every day. So we do a 7:30 call in the morning and a 5 o'clock call in the evening. That all of the staff can call into. You know, we provide, you know, information to them, and then we talk about how great everybody's doing, and just, you know, sharing little things like, hey, did you know a nurse on this unit discovered this today? And, you know, this is something that maybe we can do differently. And so, you know, we try to do different fun stuff. We're actually planning a celebration. You know, for anybody who's driven past both the Kent and the Sussex campus, we have tents outside. And so we're planning a Cinco de Mayo party out in the tents now. You know, that all the managers and the VPs and the directors are going to go out and cook pancakes for all the staff one day just to do something fun. So we try a lot of different things. But, you know, the staff, I have to tell you, they've been very resilient. You know, a lot of them have been just phenomenal. They've come up with some really cool things that we're going to, you know, keep in place moving forward. So they've been a lot of fun. They've, you know, like, they love putting the little messages up in the windows. You know, they do a lot of fun things on the units. You know, because they're all wearing, you know, hair bonnets now to keep their hair clean. You know, we have people coming in, bringing all kinds of cool little hair bonnets so they get to show their personality through, you know, creative ways with masks and, you know, hair things and socks. And so we've been doing a lot of fun stuff for them.
That's good. Whatever it takes, right?
Whatever it takes. But
Yeah.
it takes a village. And I tell you, every day there's community partners bringing in food. So if there's one thing for sure, pretty much every nurse is going to walk out 10 pounds heavier when this is said and done. Because literally everybody in the community's been bringing in food.
Yeah. Well, I came downtown and took a bunch of pictures of your windows, and I don't know if you've seen it yet, but there's a big feature in the Chamber Connections this month.
Oh, cool. I'll have to pay attention to it. Yeah. Yeah, that's really cool. I tell you what, La Baguette, whew, they bring in treats all the time. They have the best muffins.
Nice.
They bring in treats all the time. Pretty much every day, somebody is bringing in something for the staff. You know, just really making them feel special, whether it's, you know, bottles of water to, you know, people donating masks, you know, that they've made, to, you know, restaurants. I mean, every day something's happening.
That's awesome.
And we honestly couldn't do it without our community members. They've really been fantastic.
It's really cool.
Sharon, you may have said this. Are you in Kent, or you're not in the Milford?
I actually go between both.
Oh, okay, you do both.
I do both. So I usually spend 3 days a week here at the Dover campus and then 2 days a week down at the Sussex campus.
Okay.
But through the incident command, because we have that going on right now, I have to stay in incident command at one of either location, but we teleconference with them every day. So the incident command at both locations, we're on camera with each other the entire day. So we're always talking back and forth about how we can standardize things between both campuses. So it's, you know, I think it's even going to change for us as leaders on how we do meetings moving forward. Because you could get a lot more done when you have stuff like this, that, you know, you can talk to people face to face and not have them going all over the place. So
That's right.
I think a lot of things are going to change. The one thing I don't want to change is my kids going back to school, because they need to go back to school.
Teachers are suddenly even bigger heroes than they ever were before, right?
Absolutely. Absolutely. And you know what? My kids, I think, are ready to go back to school, because, you know, Heather and I were talking earlier, you know, I'm very thankful that I'm in a position where I have a job right now, but I have a husband who's been furloughed since this began. And so that's very real for a lot of families right now, where, you know, one or both parents are furloughed, and, you know, trying to, you know, figure out, you know, your income and, you know, where your next meal's coming from. I think some of our community members are really going to hurt a lot more than what we are right now. And I do worry for them.
Has anybody in the hospital been furloughed due to like not, you know, the non-elective surgeries?
No, no,
good.
Mr. Murphy, who is our CEO, he very early on said, you know, he really wanted to figure out what we could do to not do that. And so when we had to set up our call management team and we had to set up these testing sites, we literally redeployed staff from like our OR areas and some from our medical group areas where they were shut down. And that's who's been doing some of these other initiatives that we have going on. We actually have, you know, hired on temporary staff through some school nurses. We actually hired in some temporary teachers from Polytech who are running our child care center for our staff.
Wow.
So we've tried to do a lot of really cool things, you know, to even help out our community members to keep people employed. So there's I think 4 or 5 teachers from Polytech who are working over at one of the local churches that set up childcare, so that our nurses continue to have childcare very early on when a lot of those businesses shut down. So, you know, while our community's helping us, we've been trying to help some of our community members as well. So we brought in some temporary staffing to help, you know, with some of these other things, initiatives that we're doing very early on as well. So we've been fortunate.
Yeah, my cousin's a nurse in Kentucky, and they laid off almost half the staff because it was just the one, basically people that were, you know, going after COVID or, you know, helping COVID patients. Everybody else was really limited hours, and that's really great to see that Bayhealth is keeping everybody.
No, we've
working.
been
There's stuff to
fortunate.
do.
Yeah, we've been very fortunate that we've not had to furlough or lay anybody off. That we have, you know, we've even redeployed, you know, staff from some of those areas to work on the floors. So, you know, you know, just like every other industry, you know, we do have staff nurses who wind up testing positive for COVID-19, not necessarily due to an occupational exposure, but maybe from, you know, something at home and so when those individuals go out, we have to have individuals to come in to help care for our patients. And so we've cross-trained people to work in different areas. We've done a lot of creative stuff so that we did not have to furlough people.
Yeah, that's great.
Like I said, you know, our HR department, they reached out to Polytech early on to say, hey, you know, if any teachers are looking for, you know, some extra income, we want to set up a child care center if any of them are interested in helping us out. And for us, that was a no-brainer. We know they have a background check. We know that they have the skill set to teach the kids. And so it made it very easy for us to be able to do that. And there was a lot of them who very graciously stepped up to want to cover and help us out with that. So, and a lot too, you know, working close with the governor's office, you know, because anytime we do something like that, when the governor's ordered a shutdown, we have to get permission from the governor to be able to open up these sites. And so, you know, we do keep in constant contact with them as well too, to get permission to do some of this stuff. So.
Awesome.
Yeah.
So I don't want to cut you off, Sharon, but we do have 10 minutes left. So if anybody has any wrap-up questions, comments, Sharon, if you have a little bit left that you would like to talk about, we got 10 minutes. I'll give you guys a 5-minute warning too when we get down to that.
No worries.
Is there anything that you need?
You know what? I don't think so. Like I said, very early on, we've been doing a great job with our protective equipment. We actually hired a new guy about 4 months before this happened, who oversees all of our materials management. Lots of background. He has lots of contacts with different companies, and so he's been amazing to get us anything and everything we need. As far as, you know, protective equipment goes. Like I said, the community outpouring has been fantastic. I mean, you couldn't ask for a better group of people to be in this with. So it's been good.
Good. Are you able to get, I mean, I don't know what the restrictions are in terms of, you know, if this would be a germy thing or not, but are you guys able to receive mail from the outside?
Yes, we are.
Okay, so if there were groups of people that wanted to do something like send encouraging notes or something like that, they would get through?
Yes, they would.
Okay. Is there a particular place where they should be sent?
Probably. I mean, it could come through, I mean, pretty much anywhere. It'll
Just
get
the general address
you know.
would work probably, yeah.
Yes.
Okay, cool.
Yeah, I know some students early on sent some things, which was a lot of fun. So.
Carrie,
No,
do you have
no
a question?
What's that, Heather?
I think Carrie has a question, but Carrie, your microphone, something's not working. We can't hear you.
We can see you though.
Yeah, we can see you. We just can't hear you.
Good. There you go. There you are.
Can you hear me now?
Yes.
Yeah.
He is?
Sharon, you said you have a call every day with the other hospitals. Does that include the state hospitals, or is that just the private hospitals?
So it's typically not the state hospital. I mean, the state is on the call. So the Department of Health, DEMA, it's Christiana, us, BB, Nanacoke, PRMC, AI, and I think that that's it, but that's, you know, we talk every day. Really the only state hospital that is out there is DPC, which is up in Wilmington. And so, but they're such a niche hospital of what they take, because it's mostly the psychiatric population. They really have not joined in on the call.
I was just thinking, because my husband's at a hospital for the chronically ill, so.
Oh, right. No, because they are mostly long-term care. They
Gotcha.
really haven't been involved in some of the more acute care phone calls. Now, whether or not they have their own phone calls that they do, they may, but this is more of the acute care side.
Gotcha. Are you releasing patients to like DHCI or Governor Bacon that need long-term that haven't?
No, well, right now, some of their criteria to transfer patients is very strict.
Gotcha.
We have not done a lot of transferring right now. There's some facilities that are not taking people back.
Okay.
And in fairness to them, it's in large part because they don't want an exposure in such a vulnerable population.
Mhm.
You know, so, you know, typically they're your more vulnerable people.
Yeah. Okay. I was just curious.
No worries.
All right. Does anybody have any other questions for Sharon while we have her? Because I'm sure she's got a whole bunch to do after this.
Thank you for taking the time today, Sharon.
Yeah.
Oh, you know what? It's been great seeing you guys. You know, I miss seeing you guys.
Thank
I'm
you.
really bummed that our last couple of classes have been canceled.
Yep, but that's okay. We're gonna get back to normal soon.
Absolutely. One day at a time.
One day at a time. So this session is been recorded. So we're going to be able to then post this onto our YouTube channel on our website. So if you guys have anybody that you would like to share this with, you can find that link in probably just a couple short hours. It'll be up and available on our website. And then make sure that you guys check in next week and the following weeks on Tuesdays and Thursdays. We do the Real Help in Real Time every Tuesday and every Thursday at 11 a.m. And you can find the topics on our website and then also on our Facebook page. So thank you guys all for joining in today. Make sure that you wash your hands and don't touch your face.
Thank you, Sharon.
Thank you, Heather. Thank you, guys.
Sharon, thank you for what you're doing. Thank you for what
Oh,
you do
thank
every
you,
day.
guys.
Everything, Sharon.
Thank you so much.
We appreciate all of you guys. Thank you.
All right. Have a great day, guys.
Thank you.
Bye. My crazy computer here.